and welcome in. So this is the presentation for the pharmacy track with Rick and Ruby. My name's Becca. I use she, her pronouns, and I'll be the moderator today. These are actually my mom and my uncle, so it's a nice little family reunion, and they're here to talk about their experiences. So Ruby just started talking about pharmacy technician, and Rick's going to talk a little bit more about what it takes to become a pharmacist. And at any point, if you have any questions, they are totally fine with you unmuting, kind of chiming in whenever. If you feel more comfortable putting in the chat, put it in the chat, and I'll interrupt them. I've done it all my life, and I will ask the questions for you. But at any point, if you have questions about pharmacy, please feel free to unmute yourself. So Rick, I'll let you continue talking about what kind of education you need kind of in high school. So thinking about like that 9th to 11th.
Yeah, it would be good to have some chemistry background. It isn't completely necessary. When I was in high school, I didn't take any chemistry. I had biology. But I sort of wish I had chemistry back then. But I did take Chemistry 100 when I started college. And that led to my other chemistry classes, but at least it allows communication between technicians and pharmacists if you have some understanding of chemistry, because we do talk a lot about it, even though it doesn't seem like it sometimes.
I think having a better understanding of math in general is helpful. I am not good at math, as my daughter will attest to, but I learned, and as long as I'm willing to learn and keep learning every day, then who knows where I can go. I thought, right, a technician, that's it for me. I've got nothing else for this location, but I was wrong. I just learned out that I get to become an immunizing technician. So the next time you go to the store, to the pharmacy to get your flu shot, it may not be the pharmacist giving you that shot. It may be me or one of my coworkers giving you that shot. So looking forward to that. And I'm looking forward to learning about those things. So,
yeah. So Ruby talked a lot about her pathway to becoming a pharmacy technician. She went to private school. There is also public community colleges and colleges that have pathways to be pharmacy technicians. The difference between them is basically money. Private school, you pay more, but they do a lot more for you. Public school, you need to do a lot more for yourself, a lot more understanding of what the expectations are for graduating and being done. And then most people, whether you're going to be a pharmacy technician or a pharmacist, start out as a pharmacy assistant. You must be 18 years old to work in a pharmacy, and you must have some kind of license to be behind the pharmacy counter. And most people start with an assistant license because it's $35. It's super cheap. 4 hours of HIV/AIDS training, and then and an 18-year-old birth certificate, and then you can apply to they used to call it the Board of Pharmacy. Now they call it the PQAC, the Pharmacy Quality Assurance Commission. And they will give you a license, and then you'll need to apply at different pharmacies.
And there are tons of places that need cashiers desperately.
Yeah. Pharmacy cashiers.
Desperately.
And it is a challenging job, and it isn't very much compensation as a pharmacy assistant, but it is a gateway into the world of pharmacy. So if you're at all interested, I would start there. Some people get an assistant license, and if they can't find a job, then they'll volunteer, especially in hospitals. So retail pharmacies often have cashier positions, but hospitals don't generally need cashiers. But they do need volunteers to do pre-packing and bubble packing and things. And so you can get good experience that way if you want to move on to apply to pharmacy technician programs or pharmacist programs. So I'm a pharmacist at Harborview. I've been a pharmacist since 2001. But I've worked in pharmacy since 1990. So I have a ton of experience, both as a technician in hospital and retail, and a pharmacist in hospital and retail. Most of my beginning experience in pharmacy, my first maybe 16 years in pharmacy, I was a hospital person. And then I moved to retail about 6-7 years ago, somewhere in there. And I've worked outpatient and retail settings. Now I work for Harborview, but I work for UW Medicine. And my job is mostly, right now I'm working from home because most of my job is on the computer, which is pretty rare in pharmacy. Most of the time you need to be in the pharmacy to do the work we do. Most schooling to be a pharmacist is preparing you to take the PCAT, the pharmacy aptitude test to get into pharmacy college. The University of Washington and Wazoo both require that test. The University of Washington, you will have to finish all the way through biochemistry before you can apply. And that changes sometimes. Sometimes they want you to be done with biochemistry, and sometimes they want you to just be done with OChem, depending on the year. But I think they've settled finally on you need to be done with biochemistry the last time I talked to them. Yes, Becca.
OChem is organic chemistry.
I'm sorry. I was getting there.
I was waiting for him to finish.
So your first year, most people who are going to be a pharmacist, their first year of college is your chemistry 100. It's not basic or intro chemistry, it's the Chem 100 series. So it's usually 150, 151, 152. And it's metal chemistry and basically thinking like a chemist, learning the basic fundamentals of how to do chemistry math and how molecules work. And at the same time you're doing that, you should also be doing your biology 150 series as well. So that's usually your first year of college. Second year is organic chemistry. We call that OChem. And that's your 250 series. So 251, 50, 51, and 52. Those you can do several ways. Bellevue College actually has a summer-long program that you can fit your entire OChem series, the whole year, into 3 months. But you do have a midterm every Friday, this is what they say. And you spend the morning in lecture and the afternoon in lab, or vice versa, depending on what section you're in.
Very
and then
intense.
Usually, what's that? Yes,
very intense. Yeah.
Now you know I don't want to be a pharmacist.
And usually, after you're done with that, is when you can apply to the majority of pharmacy schools in the United States. Sometimes they let you apply before you're done, but while you're in it, and they look at your progression through the grades, so they won't accept you until they know how you've done in the series, or they just make you wait until you're done. It depends on the school. The University of Washington used to let you apply halfway through OChem series, but now they make you wait until you're done with biochem. And they want you to take that PCAT. They didn't have that when I was in school, so I'm not exactly sure how it's used really well. I sent an email asking them and nobody replied yet. So if they do reply, I can let Becca know and she can tell you. But it's the test that they use to decide if you have the aptitude to go to pharmacy college. It's the pharmacy college aptitude test, just like an MCAT for medical school, the medical college aptitude test, or the LSAT, the legal school aptitude test for law. So those are all those different professional graduate program tests, and there's a ton of them really, but those are the basic ones. Most people, so the UW doesn't require pharmacists to have a bachelor's degree because they don't require physicians who apply to medical school, or students who apply to medical school, to have a bachelor's degree. So they can't make pharmacists also have a bachelor's degree, but most people end up with one. I have a bachelor's in cell and molecular biology, and I'd say about 50% of my class had bachelor's degrees. By the time you finished all the requirements, you were just so close, you did it. There's a slightly different pathway for medicine because they require physics, pharmacy doesn't. And then at Wazoo, the last I spoke with that advisor, they still let you in but before your second year begins. So even before you started OChem at Wazoo, you know if you're going to be able to go to pharmacy school when you're done or not. There's a couple of different types of program. Right now in Washington, there's only the Doctor of Pharmacy degree that you can get through colleges. Montana, they still have bachelor's degree and PharmD degree, but you have to, in your second year of pharmacy school, you decide which path you're going to go on. Bachelor's of Pharmacy is only 3 years, where your Doctor of Pharmacy is 4 years. And then usually after your Doctor of Pharmacy, there's a little bit of job training, residencies, things that you'll do as well for a year or two. And then the University of the Pacific in California, it starts with an S. I can't remember the name of the town. I've been through it once, but they have a all-inclusive 2-year PharmD program, but you have no breaks. You go straight through, just like the Bellevue College OChem series. You go straight through for 2 years, and you have your PharmD when you're done, but you really have nothing else. Yeah.
You wake up, you go to bed, it's all pharmacy all the time.
So at this point, I just would like to know if anybody has questions, because that's a lot of information. And I know most of your questions center around schooling. So please feel free to unmute yourself and ask anything. Okay.
Maybe while students are thinking of their questions and typing in their questions, I can ask you a question.
Absolutely.
What made you originally get into pharmacy? So Ruby, mom, I know you went in because my uncle was like, you should do this, but besides that, can you kind of tell them like what got you into it? Like, as these are high schoolers, you know, they're thinking of their passions now.
So before you were born, I was in the military and I was a cook. And then I got out of the military and I started having babies. I have 4 of them. And I was a stay-at-home mom for 20 years and I loved it. I wouldn't trade it for the world. But then I needed to find something to do with my life, and I was older. Where do I jump in? You know, what do I do? I love books. I love reading. My daughter will tell you I read all the time, just like she does. And I just stop that. Sorry.
Talk.
Your uncle's clicking buttons. And so I just needed something that I wanted to do, but I didn't want to go to school for years. I had kids to feed and, you know, mortgage to pay. And so I tried the library technician for a year. I was in the program. I finally got into the class that I was supposed to have from day one. And the first thing out of their mouth was, the government is shutting down libraries and there's no jobs to be had. Okay, there was a year of my life gone. What do I do now? Still got kids to feed, still got a mortgage to pay. And my brother says, people will always need their drugs. As you get older, they're all going to need their drugs. You're going to have high blood pressure too. And he's, you know, he's right. So he said, you'll be fine. You'll like it. I'll help you. Well, I'm fine. I've had my job for 8.5 years now. I've worked with Rite Aid since, I don't know, I got my job 2 weeks after I graduated and been there ever since. I've been to multiple Rite Aids, about 12. And I like retail. I don't want to go into the hospital setting yet, maybe as time goes on, but right now I like getting to know my customers, getting to know their children, watching their children grow up. The bad part about retail is when you get transferred to a new store, you just have to meet all new people. And I miss my old store, but I have a lot of fun at the new one, and I get to learn new things at a new store. And yeah, so I still blame him. I will always blame him, but it's a good job and I'm enjoying it. And I like my direction I'm going with it. I'm really excited to learn how to immunize. I know for your uncle, for Rick, it's old hat. He knows how to do it. He knows how to stab people, but I don't. So let's see where it goes. So I do have a question for someone, Amanda. It says technician next to your name. Are you a pharmacy technician?
No, unfortunately, I am just teching for you here in this room. So I'm recording, I'm doing that kind of thing.
Hey, had to know.
Super
Maybe,
important.
possibly.
Hey, it's a lot of fun. Come play.
All
Does
right, does
anybody have
any
any?
students, yeah. Okay, so Anna asked, what is the experience like as a pharmacist in a hospital setting? So Rick, you're up to bat.
I'm up.
Which
Okay.
setting?
In a hospital.
No. Which hospital setting?
Oh, I was a clinical pharmacist at Valley for about 6-ish years. And then I went to the anticoagulation clinic there. So I have a good deal of pharmacist experience in the hospital. It's very fast paced. The nurses want everything and they want it yesterday. And if no matter how fast you do something, it's never fast enough. But it is a good, challenging job. And I loved working in the hospital. It's hard sometimes to see people so sick. Especially, I worked at Children's as a technician before I became a pharmacist for 2 years. And that was all I could really take, because it's hard to see kids being real sick and in dire places. So people who can do that work, that's fantastic. And I still have friends that work at Children's and they love it and they're very committed and wonderful people. But even seeing grown-ups can be pretty hard sometimes. Especially a lot of my job as a clinical pharmacist was pain management. We prescribed all of the pain meds for post-op patients and emergency room admits and chronic pain patients that were admitted to our aftercare oncology floor at Valley. The transitional care unit is what it's called. So I have a ton of narcotic prescribing experience. And it's tough to see people in real pain, and that's not going to end. But it was a good experience. It taught me a lot. It taught me a lot about myself and about other people and what people can handle in their lives. Is amazing. But it is fast paced, and we did a lot more than pain management. We did about 14 different protocols. So we did anti-nausea for women who are pregnant. We call that hyperemesis gravidarum. Usually in about the 4th to 6th month of pregnancy, women start getting very nauseated, or can, not all of them, but many do. And it's not necessarily just in the morning. It can often become a day-long thing, or days-long thing, weeks-long thing, where it builds in a cycle. And so we try to stop that cycle with medicine, and that can help. And then we also worked on TPN, so food that comes through your IV, and we worked on alcohol withdrawal. So people who come in who've used too much alcohol and they need to detox off of that, it puts them at great risk of seizures and other serious complications. So we did a lot of that medical management. Hypertension, we worked on those patients who came in with hypertensive emergencies, and trying to bring their blood pressure down to a manageable, reasonable level without having a stroke or heart attack. So we did a lot of interesting, good work at Valley, but it was very hectic and very stressful. But I did like it.
Thank you.
And then working in
Juliet,
the retail setting is different. Go ahead. I'm sorry, Becca.
Oh, I was going to move on to the next question, but if you wanted to talk about retail experience for maybe a minute, and then we'll move on to the next question.
Okay.
So, well, I was going to answer her question.
Go for it.
So it's not years. When I went to private school, it was 9 months plus 1 month of externship. So 10 months all total. If you do the route where you do on-the-job training, they say it's self-paced, but they want you to get it done in relatively that amount of time. So it's under a year to become a technician. And then about 8 to really know what the heck you're doing.
Okay, and just so I can say that loud and everyone catches up, that was the answer to Juliet's question, which was how many years of school do you need to become a pharmacy technician? And I stand corrected. We actually have 10 minutes left because we had some technical difficulties. So we are going until 4:20. So students, if you have questions, this is a great time to be posting them or unmuting yourself. But yeah, I'll pass it back to Rick and Ruby if there are other areas on your agenda to cover.
What do you want to know, guys?
Well, one of the questions Becca asked was, how did I get into this? Way back in the Stone Age, 1990, I had just moved to Seattle, and my friend Clark was working at Swedish Hospital as a pharmacy technician, and I was working in Bellevue as a burn security guard. And it didn't pay very much, and it was kind of very boring work. You basically just walked around an empty building all day. It wasn't very challenging. And he said, well, we need a night shift technician, and if you will promise to work on our night shift for a year, they'll train you on the job. And so I did that. I became a pharmacy technician at Swedish. I think it took me just a couple months. They didn't have all of the requirements.
This was long before
that they have now. Like I said, it was a Stone Age. So it was a Wild West back then. And then I became a technician. I stayed at Swedish for a few years, and I knew I needed to go back to college. So I went to Children's for a couple years, and then I ended up at Valley, and that's where I started pharmacy school, and I became a pharmacist.
I wanted to add to Juliet's question about, I don't know if she was here at the beginning when we first started this, about how many years, it only takes about 10 months, but like Rick was saying, this was a long time ago for him. Nowadays, there are tests that you have to pass, and you have to get your license. And then once you get your license, every 2 years, you have 20 hours of continuing education that you have to do. And all of that's online. And most places that you work have websites that they pay into that you can go get those CEs done. I know Rick has more than I do, and a lot more, but he also has the ability to get those done through his work throughout the year. And so as long as you keep that up, you will never have to take that national test again. Trust me, you don't want to take that test again.
So for pharmacists, once you become licensed as a pharmacist, you do have to do continuing education every year, and it's 15 hours a year. It's due when your license is due. So I usually get mine just before midnight on my birthday, but I get it in. And then if you're late, you don't have to resit the boards, but you do have to pay an extra fee, and it's pretty hefty. And then you also have to add more hours of CE to that. I don't know how many because I've never done it, thank God. And then so you take 2 exams when you become a pharmacist. You take your exam to be a pharmacist. So they test your general knowledge of what a pharmacist should know. And then you also take your law exam. So pharmacy is the most regulated profession in the United States because it's drugs, right? So you need to be very versed in state and federal laws that apply to medications and how they're dispensed, and how you need to comply with those rules to get them dispensed legally. And then if you move from Washington to California, or from California to Ohio or whatever, whenever you change states, you only need to sit that state's law exam again. You don't have to take, except for California, they make you take both tests over again down there. But now all the other states, they only make you take their law again.
And technicians are required to have 1 hour of law as well when we renew our CEs. So
awesome. So we'll pause for a moment. There is, Amanda just put something in the chat. You will find a survey link. We would really appreciate that if you could fill it out right before we switch off. We have about 4 minutes left. So just go ahead and get that done real quick, and ask any questions, right? Like, this is a great opportunity to hear from 2 very different perspectives within the field of pharmacy, right? And so a lot of different educational backgrounds required, a lot of different work that's required. So this is a great time to get that kind of experience and feedback.
Well, my only parting comment, I guess, would be that if pharmacy is something you're interested in, the best way to find out if you are interested, become an assistant, become a cashier. That will get your foot in the door, and you can see the good days and you can see the bad days, because there are both. There's highs and lows, no matter whether you're in the hospital or whether you're at retail. You know, you'll have the sweet little old ladies that you'll bend over backwards for, and the crazy old grumpy guy that just says, bah. So, yeah.
And pharmacy schools like people with experience. And I know it seems like your 18th birthday is a long way away when you're in the 9th grade, but really it happens way faster than you know it. So I know it's frustrating to have to wait to be 18 before you can do any of the stuff to work in a pharmacy, but just kind of prepare ahead of time. Learn the Pharmacy Quality Assurance Commission's website. That it's under the Department of Health. So doh.wa.gov is the general website, and then you can click on the Pharmacy Commission from there, and it will guide you through all of the different general areas of knowledge that require licensing. They have separated it all by profession. So if you're an assistant or a technician or a pharmacist. I became a pharmacy technician so long ago that we used to have two kinds of pharmacy technician. We didn't have pharmacy assistants. We had a technician A and then a technician B. And now we don't have that. We have an assistant is what we used to call a technician B. And an assistant is what we call a technician B, and a technician is what we used to call a technician A. So it's very confusing back then. So we've moved past that.
We are appropriately labeled now.
Some of the things that we deal with on a daily basis, we can talk about that. Legibility of doctors' handwriting can be very challenging. We use a lot of medical speak, so we use a lot of abbreviations for things. So instead of every day, if you talk to a nurse, a doctor, or a pharmacist, or an assistant, they may say QD, right? Instead of daily or every day, they'll say QD, QD, BID, twice a day, QID. And then we also, in the pharmacy, in retail pharmacy, a big concern is the day's supply. Insurance companies will cover a certain number of days per dispensing of medication. So you can get a 30-day supply, a 60-day supply, or a 90-day supply. And that seems very easy, but it can be a challenge. Yes, Becca.
Thank you for attending. We appreciate it.